Uh, Hello, class. This is Team One presenting this week again. On the first week, we presented on ethics in general, and then also presented on ethics information system, and also presented on ethics in data analysis. Last week, which was week 4, we were able to present to continue the discussion on the algorithmic bias, and so this week, we are going to try and narrow down to go to specifically on the ethical dilemmas in analyzing um, healthcare data. As we have noticed over the last few years, we have seen an increase in the use of technology in the healthcare sector. In one of our discussions, I think somebody mentioned that we are seeing devices such as devices for monitoring blood sugar being used to collect data on important vitals in the healthcare sector. And so we are looking at what are some of the ethical dilemmas that might arise, or what are the challenges in trying to analyze this data and in collecting the data. This is because, as we notice, as we are going to notice in this presentation, um, one is that unlike the other types of data that we collect, this data is monitored or supervised, or there are many laws that govern collecting data in the healthcare sector. One would be things to do with privacy, things to do with confidentiality. These are issues that will add up to our ethical dilemma when we are looking at data in the healthcare sector. So, in trying to view, uh, in trying to analyze this data, we see that first, there's been an increase in analyzing data in the healthcare sector. So some of the sectors include in biomedical and also in healthcare research. And this analysis gives a lot of benefits to the stakeholders in the industry. One, you can be able to create, I mean, create preventive, diagnostic, and therapeutic. You're going to gain those benefits by utilizing this data and by analyzing data in the healthcare sector. And then, but there have been also other proposals by researchers such that instead of just using directly the data that you collect from a patient, you could use other data that do not encroach into their privacy. One of a good example was you could use trends in Twitter. For example, if they're searching on COVID, you could use that one and map out that data, and you can be able to see the general trends with COVID in those areas. For example, you can see this area, it's like there have been increased discussion on this disease. It means maybe this disease is actually affecting the people in those areas. So you can map up the address using the IP address, and you can see the trend and see how it's changing over the weeks, and maybe recommend preventive actions, vaccines, medications, something like that. So another example of these Twitter feeds that I'm saying you could use instead of just using directly the data is you're using these Twitter feeds to measure public interest or concern about a health-related events. For example, the outbreak of COVID, influenza, and such diseases, or maybe flu. You know, you can be able to see from those feeds if discussions of on flu have started around the month of October. You can be sure that maybe there's a new flu. I mean, there's a disease that is coming, and so we need to start talking about vaccines, talking about preventive measures, and recommending them. That's one way of avoiding the ethical dilemmas of analyzing healthcare data. So, a review of ethics of big data in healthcare research revealed that ethical dilemmas arise mainly in the areas of privacy, informed consent, confidentiality, fairness, and data ownership. For example, the hospital where you click in, say this is my age, okay, this is my ethnic alignment, for example, African American, white, or something like that. So when you leave that data over there at the hospital, you have not consented, or you are not even informed that this data might be used by some insurance company in a different state or in a different country. So these are issues that are key that need to be addressed. Even when you collect that data, how you sell it or somebody use it to gain some financial mileage on with it. So does the patient get paid? How do you earn, or how do you compensate them for their data? These are some of the ethical issues that we have in the healthcare sector, but generally maybe no other sectors too, because who owns the data? So this chart over here is useful in explaining. It's useful in like trying to show you how interlinked the data we collect is useful in that sector, in that industry of healthcare. So you collect your data, maybe as an healthcare professional or something, and then you have a lot of departments or sectors that are using the data. You have the ICT industry, you have governments, you have policymakers, then you have analytical people, maybe like data scientists, and then you have people who are doing research, people who are working in public health, and we have health services. You know, if you look at all these stakeholders that need to use this data, you can be sure that this data might be misused in the long run. It might fall in the wrong hands. People who are not don't take the same precautions that you, as somebody who has been trained, maybe in the healthcare sector, would take such precautions such as confidentiality, the privacy, looking at the healthcare policies that govern data. So these are some of the ethical dilemmas that we are faced when trying to analyze, maybe even store, or even make sense of the patterns in our data. So Dimitrov, in 2016, in his research, focused on the internet of wearable devices. You have the Apple Watch, you have Fitbit, things that monitor maybe our heartbeats, steps. First, he knows that they're important. They're key. They can be used to prevent, diagnose diseases before even the disease occur, and manage chronic illness such as diabetes and other diseases. So these devices are very useful in monitoring health indicators. They can monitor symptoms, support fitness, administer health education through maybe recommendations. You need to take these steps, you need to work out on this, you need to reduce this. So they're actually helpful. But what's the dilemma? Like once you collect that data, or once that data is collected by this device, then the question is, how is that data really used? Who uses the data? How do I give? Do I give consent for my data being used by another or by that party? You know. So my question would be: do IoT devices in the healthcare sector take away healthcare jobs? Is it ethical or unethical to automate tasks in healthcare using technology to have a faster way of collecting, analyzing, and recommending solutions to stakeholders in the healthcare industry? So this is much of a ethical question. So this would be a question from Team One for this week. Thank you.